Welcome to StudyNeuro. This presentation focuses on postoperative and delayed complications following posterior communicating artery aneurysm clipping, with emphasis on early recognition and practical management during the recovery period after aneurysm surgery. Careful monitoring matters here. We will examine important complications that can develop soon after surgery, next to delayed neurological problems that may appear later during recovery, while also discussing systemic complications, monitoring strategies, and key management principles commonly used in neurosurgical and intensive care practice, where patient status may change rapidly over time. Join the StudyNeuro community for focused neuroscience education and practical clinical insights shared across YouTube, Facebook, TikTok, Instagram, and X under the StudyNeuro platforms. More neuroscience content will be coming soon. Posterior communicating artery aneurysm clipping is an effective surgical treatment, but it is not without risk. Complications can still develop after an otherwise successful operation, and they often shape the final neurological outcome in patients who undergo this procedure. These complications may appear at different stages of recovery. Some occur early in the postoperative period, while others develop later after initial stabilization, and this timing often determines how quickly they are detected and managed in clinical practice, where subtle neurological change can be easy to miss. When we classify these complications, we first think about early postoperative problems, such as bleeding inside the brain, reduced blood flow leading to stroke, and blockage of cerebrospinal fluid causing hydrocephalus. Next are delayed complications, mainly vasospasm, which reduces cerebral perfusion days after hemorrhage, and chronic hydrocephalus that can persist and gradually worsen neurological function over time. Finally, there are systemic complications that affect the whole body rather than only the brain, including infection, blood clots forming in the veins or lungs, and electrolyte disturbances that can make the patient's condition unstable if not corrected early. Hemorrhagic complications after PCoA Aneurysm clipping refer to bleeding events that can occur in or around the brain even after surgical treatment has been completed successfully. These include blood collection within the brain tissue, bleeding beneath the dura, and in rare cases, rebleeding after the aneurysm has already been secured, which is uncommon but still clinically important. When these complications occur, patients often show a sudden and clear decline in neurological status, and consciousness may drop quickly, especially when bleeding increases pressure inside the skull and disrupts normal brain function in a way that demands urgent reassessment and possible reintervention in a surgical or intensive care setting. Ischemic complications, on the other hand, are related to reduced blood supply to brain tissue rather than bleeding. They usually result from vessel narrowing due to vasospasm, blockage of an artery, or even low blood pressure that reduces cerebral perfusion during a vulnerable postoperative period. The clinical picture is often focal and severe, with weakness on one side of the body, language disturbance when dominant hemispheres are involved, and visual loss when posterior circulation pathways are affected, and these deficits typically reflect the exact brain region that has been deprived of adequate blood flow. Acute hydrocephalus is a rapid buildup of cerebrospinal fluid that usually occurs after hemorrhage disrupts normal CSF circulation around the brain. It can develop early after aneurysm rupture or clipping and may quickly raise intracranial pressure. This complication progresses fast. Patients often present with reduced consciousness, headache, and vomiting, as ventricular enlargement begins to affect surrounding brain tissue and normal neurological function during recovery. Management aims to relieve pressure and restore CSF drainage. An external ventricular drain is commonly used for temporary diversion, while persistent hydrocephalus may later require a ventriculoperitoneal shunt for long-term treatment. Vasospasm is a delayed complication that usually develops between 3 and 14 days after hemorrhage, when cerebral arteries narrow and reduce blood flow to the brain. It is a major cause of delayed cerebral ischemia after aneurysm treatment. This can become serious fast. Reduced perfusion may lead to new neurological deficits if affected brain tissue does not receive enough oxygen during recovery. Prevention and close monitoring are essential. Nimodipine is routinely given, Adequate hydration supports cerebral blood flow, and regular neurological exams with transcranial Doppler help detect early vessel narrowing. Chronic hydrocephalus is a delayed complication that may develop weeks after hemorrhage, when cerebrospinal fluid gradually accumulates and ventricular enlargement begins to affect normal brain function over time. Patients often present with progressive cognitive decline, difficulty walking, and loss of bladder control during recovery. These symptoms are often subtle initially. Systemic infections are also important postoperative concerns. Wound infections and pneumonia commonly occur in critically ill patients, especially after prolonged intensive care admission or mechanical ventilation, where reduced mobility and invasive support measures increase infection risk significantly during recovery. Thromboembolic complications involve abnormal clot formation within the venous system, including deep vein thrombosis and pulmonary embolism, both of which can become life-threatening if not recognized early, particularly in immobilized postoperative patients who remain in bed for extended periods after surgery. Prevention remains essential here. Early mobilization and routine prophylactic measures help reduce the risk of venous thromboembolism during postoperative care. Electrolyte imbalance is a common postoperative issue after aneurysm surgery, and one of the most important disturbances seen is low sodium levels in the blood, a condition known as hyponatremia. It usually develops due to either inappropriate antidiuretic hormone secretion or excessive renal salt loss in the context of brain injury. This needs attention. When sodium levels fall, patients may develop neurological symptoms because the brain is highly sensitive to changes in osmotic balance. Confusion is often an early sign, and in more severe cases, seizures can occur, especially when the imbalance progresses without correction in a postoperative neurosurgical patient. In summary, complications after PCoA aneurysm clipping may appear early or later during recovery, and they often influence overall neurological outcome in ways that are sometimes not immediately obvious. This matters in everyday clinical practice. Early recognition and continuous monitoring improve outcomes significantly because subtle neurological changes can be missed unless patients are observed closely in both intensive care and ward settings with structured clinical assessment. Prevention strategies remain absolutely essential here. Multidisciplinary care involving neurosurgery, neurology, critical care, and rehabilitation teams support safer recovery, especially when complications develop unpredictably and require coordinated decision-making across specialties. Join StudyNeuro community for high-yield neuroscience education available across YouTube, Facebook, TikTok, Instagram, and X, where regular clinical insights and learning content are shared for students and clinicians worldwide. Thanks for watching. Stay tuned ahead.